Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pharmacology of tetracycline. Tetracyclines are a group of compounds with four fused rings with a system of conjugated double bonds. Substitution of this ring forms the variation in the drugs. Common tetracyclines are democlocycline, doxycycline, minocycline, tetracycline. We have also oxytetracycline. Mechanism of action: tetracyclines are protein synthesis inhibitor. The tetracycline enters the bacteria by passive diffusion or via energy-dependent transport protein. The tetracycline binds reversibly to the 30S subunit of the bacterial ribosome. Therapeutic uses: tetracyclines are broad-spectrum bacteriostatic antibiotics. So they should not be given to the immunocompromised patients. This drug is very popular all over the world, and it is also comparatively cheaper, and it is used in many levels. Therefore, it has developed resistance in many countries. This is the drug effective against gram-positive, gram-negative bacteria as well as non-bacterial organisms. Effective to treat anthrax, that is caused by gram-positive rod, Bacillus anthracis, cholera, that is gram-negative rod, that is called Vibrio cholera, Rocky Mountain spotted fever caused by rickettsy, Lyme disease caused by a spirochete called Borrelia burgdorferi, Mycoplasma pneumonia, chlamydial infection, maybe STD, Chlamydia trachomatis, or it may be Chlamydia psittacosis, and anaerobic infection like that of Clostridium perfringens or Clostridium tetani. Pharmacokinetics: tetracyclines are adequately absorbed from the intestine. Milk, calcium, iron, and antacid, which are chewable antacid containing aluminum, decreases absorption. So this drug should be taken in empty stomach. Tetracyclines can penetrate all the organs like liver, spleen, kidney, lung, and body fluids. It may be found in the body fluid, in tears, saliva, and milk. Okay. It may go to the cerebrospinal fluid, specifically the minocycline. It can reach the cerebrospinal fluid, and other tetracycline can go in very small amount, but minocycline goes more or less smoothly in the cerebrospinal fluid. It can be deposited in the developing teeth and bone. Tetracycline crosses the placental barrier and deposits in the fetal bone and teeth. Okay, and deposit in the it can be deposited in the developing bone and teeth. Tetracycline crosses the placental barrier and deposits in the fetal bone. Okay, it can be deposited in the fetal bone and teeth. It is metabolized in the liver, excreted in the bile. Then most of the metabolized product will go to the circulation and excreted through the kidney. The doxycycline is an exception. It it is excreted through the bile. Okay, we got that. Adverse effects: epigastric discomfort because of direct irritation of the tetracycline to the stomach mucosa, deposition in the bone and teeth. There is a problem, especially for the growing bone and teeth. Discoloration and hypoplasia of the teeth and temporary stunting of growth. Fatal hepatotoxicity, especially in a pregnant woman with pyelonephritis, may happen. Phototoxicity, so exposure to sun cause skin rash and redness. Pseudotumor cerebri, intracranial pressure may be a little bit increased within range, but at the top level of the range of cerebrospinal fluid pressure. Vestibular problem, because the tetracycline can go any of the body fluid, including the endolymph, particularly minocycline, that may lead to vestibular problem like that of the dizziness, nausea, vomiting. Superinfection with candida, that is a problem. Tetracycline intake may lead to vaginal candidiasis or oral candidiasis. There may be resistant staphylococcal infection of the intestine. Also, there may be pseudomembranous colitis caused by Clostridium difficile causing pseudomembranous colitis. So, what are the contraindications for tetracycline? Tetracycline should not be given in a patient who has renal failure or kidney failure. Pregnancy, it is contraindicated during pregnancy. It is contraindicated to the breastfeeding woman and children under the age of 18. Okay, that will prevent the discoloration and weakness of the teeth and bone. Okay, we got that. And that's all about the pharmacology of the tetracycline. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.